Hello, friends. So, it has been 2 months since my last session of the transcranial magnetic stimulation therapy, the TMS therapy. And I thought that I would do a little check in. I also wanted to say that I'm actually wearing an old set of dentures right now because my new set has caused a sore. And so I was hoping that by wearing these, it could heal a little bit. If I'm talking weird, it's because I'm not used to wearing this set anymore. And sometimes I sound like Gopher from Winnie the Pooh, and my S's will whistle. If that happens, please laugh along with me. It's obnoxious, but hopefully this gets me through these next few days while everything heals up. Anyway, it's been 2 months and 5 days since my last session, and there are some things that are definitely different and better. There are some things that have not really improved, and some things that I was hoping would be better that did not get better. So let's talk about it. The first thing that has pretty much gotten better is that my level of anxiety is low enough now that I can get away with using an anti-anxiety medication about once a week now instead of every single day. So that's a huge improvement. My brain is still pretty well hardwired for anxiety. It's simply a fact. The reason it is that way is because I have complex PTSD, years, decades of trauma, consistent trauma will do that to your brain. It will hardwire you to always be on alert. Here is what made me want to give this update today. When I walked into work this morning, I could feel the anxiety in the air. I could feel at work today the level of depression. Most people are not that intuitive, but it wasn't 30 minutes later that other people started saying things don't feel right, or somebody's upset about this, or this person in leadership is not happy with this person in leadership. And I knew as soon as I walked in the door. That's really tough to carry around with you all the time. And I only mentioned it this morning to my colleague because I felt like somebody needed to know that it was noticed. Now, he can't necessarily do anything about that. And there's a reason why I'm not in leadership. First of all, I didn't apply for a job in leadership, and I could have gone and worked at another place in leadership. In fact, I could have stayed where I was in leadership. But I didn't want to do that because I don't want to manage people anymore. I've spent 23 years managing people, and I didn't want to do it. So I left. I like the fact that I can go to work, do my job, go home. I don't worry about getting after hours calls. I don't worry about being called in. I don't worry about having to work weekends and nights and holidays. It's nice to just be able to do my job and go home. But things have changed where I work, and there are some people who are not handling it very well. There are some changes that I'm not real pleased with. It's something that I'm riding out because I think that over time it will get better. That has not affected me nearly as much as I think it would have if I had not had the TMS therapy. I really think that I would be struggling a lot more if I hadn't done that. So that's a positive thing. One of the things that I've noticed that has not gotten better is my sleep. My sleep really is not better at all. And I was hoping that it would improve. I didn't sleep as a baby because hypervigilance does that. But also, I take a medication that makes it so that I have essentially hot flashes, and it was kind of overdue for my last dose of that medication. It's injected. And I do that injection myself and had pretty much ignored it, forgotten about it. And by the time it gets to the point where it's due again or overdue, sometimes I just don't really sleep well. It also affects my digestion quite a lot. And so if you're up in the middle of the night because you're sweating yourself half to death, and also you have to get up a couple of times to use the throne, it doesn't make for a very good night's sleep. And there are times when I just don't sleep at all. Last night I only got about 4 hours of sleep. That tends to be a bit of a normal thing for me, and so these days I just put up with it like I always have. And that's that. Sadly, anti-anxiety medications rarely do very much to help me sleep. And I don't really have conscious anxiety, I'm just awake. So that has not gotten better. Bit of a bummer, but, mental health-wise, things are fairly decent. They're okay. I am not feeling like I need to be all over the place all the time. Like, my brain isn't quite so monkey mind every single day. My memory has improved a little bit, although I am still trying to keep lists and set alarms, because a lot of the time I just don't remember things. I recently had to get a new laptop at work because my laptop kind of went berserk and it uninstalled the sound card for itself. Like, just completely uninstalled it, and the IT guy couldn't fix it. So they gave me a different laptop. And ever since then, I haven't been getting alerts for my appointments. So I have to really keep up on my calendar and pay close attention to things that are going on. I need to set alarms, which I do on my phone, so that I can be reminded of when I need to go and see people. I don't like being late for appointments because I have high expectations for myself, and I always try to be on time for my clients. So that's kind of a pain, and that's really contributing to my not really lack of attention to those things, but my ability to stay on top of things has been limited by that. But that's, I think, just a glitch, and I'll probably figure out some adaptive way of getting past that. When it comes to my ability to remember to take my medications, that has also not really improved all that much. I do take them every workday. I have an alarm that goes off that allows me to remember to take them, and I have a very good work colleague who actually will occasionally ask me and remind me, especially if, like, when my alarm went off, I was on the phone, and she'll hear the alarm go off, and then when I get off the phone, remind me to take my medication. So that's been very helpful, and in fact, she takes her medication at the same time that I take mine. So we've kind of helped each other. But on the weekends, because I don't sleep good, I tend to let myself just doze and rest a lot of the time all the time on the weekends. And those alarms are only set for Monday through Friday because I don't want to have to get up and potentially interrupt what sleep I can get and then take those medications in the morning. So I do need to do better about that. I do need to find a way to make that into a routine. Sneeze break. The other thing that I also notice is that I don't know if I need to go on the higher dose again of my medication. My doctor took me down from 100 milligrams to 50 milligrams because I was experiencing some pretty significant sleep disruptions while I was on that medication at the higher dose. That happened almost right away after upping the meds. But I think if I can get past that and give my body a chance to adjust, I might find that things get better. But I'm going to talk with my doctor about that. And in fact, I've had a problem with my neck. Before Christmas, I had some time off because my neck seized up and I couldn't move. And it hasn't gone away. It's still there. Like today, the right side hurts. Last week, I had problems with the left side, and it just keeps rotating back and forth. Sometimes it hurts right in the center, and I need to see the doctor. I need to have someone take a look at my neck because my mother, my sisters, and I all have a degenerative disc disease. And I think that I have progressed a little bit. I've crossed a threshold, and it is causing significant pain and immobilization sometimes. So when I go to that appointment, I will talk with my doctor about getting back on the 100 milligram dose. And I actually have a whole, I think, 30 days worth at least, if not 90 days of the 100 milligrams. And so I can put myself on it without having to have another prescription right away. And then if it doesn't work out for me and I'm still struggling after that, then maybe I can go back down to the 50 milligrams if necessary. But I don't believe that I'm getting the actual therapeutic dose at this point. And because of that, I'm probably not seeing as much of a boost in my energy level, as much of a boost in my memory, as much of a boost in my ability to be able to function every day. And deal with the issues regarding this damn depression that does not want to let up. So that's an update of where I am in this process. And of course, I will continue to battle through this. This is not something that I can ever really stop doing as long as I'm alive. Because I refuse to let myself be the kind of person that I was before I had the TMS therapy. Things have gotten better. If you're considering doing it, I would recommend it. If you've not tried it yet, try it. You could find that you have real benefits from it. Now, the medication that I am on, here was my whistle. The medication that I'm on is desvenlafaxine, which is the generic form of Pristiq. I had to get a genetic test to tell me what kind of medication would work for me because I had been on a bunch of different meds and none of them worked because I wasn't on the right kind of meds. I was on SSRIs and those don't work for me. I needed to be on SNRIs. Well, it turns out that I can't take Wellbutrin, which is the other medication for depression that's an SNRI. And the reason is that I have a history of epilepsy. And Wellbutrin is well known for causing seizures. So there's a little update on how things are going. At this point in time, I feel like my life is balanced enough that I'm doing okay. Will I ever consider going back and having like a refresher or a booster or anything like that? Possibly. But that would definitely be later in the year because I haven't really seen like a fall back into anything except at the time of the election. Today being January 6th, it's not easy for me to come to a place of acceptance, but I have to. And knowing the possibility of all the things that can happen, I can't let that get in the way of my life. At this stage in the game, it's all just conjecture, and he hasn't even taken office yet, so I'm not going to let myself worry about such things. And I think that if I hadn't had the TMS therapy, I probably would have been a lot worse off after the election. That said, I think that's enough for now. If you've made it this far, thanks so much for watching. Thank you for caring. I really do appreciate you. We don't know each other probably, but thank you for connecting with me. Thank you for following this whole process. And if you're going to even consider doing it for yourself, and you have any questions, feel free to reach out to me. Just make sure when you send a message that you let me know that's what it is. If you just send me one of those little waves or something, I'm not going to respond. Because I try to stay off of social media as much as I can, except to do things like this and to go into the videos of the people that I follow closely. I have taken quite a break from social media, particularly off of Facebook, and I don't do really any of the other social media except occasionally I'm on Blue Sky, but I'm really not there a lot. I don't go there every day, and this has been helpful to my mental health as well. But I would recommend that you do it if it's something you've considered. It's worth a shot, and your mental health and your life matter. It means something to me that you have the opportunity to make your life better. And really, only you know what's best for you. So if you have questions about it, let me know. I can only tell you what my experience has been like, but I'll be honest with you and answer as many of your questions as I can. Anyway, thanks for watching. Happy Monday. It was definitely a Monday today. I wish you well. Take care.